Dry eye syndrome. Dry eyes, also called keratoconjunctivitis sicca. Dry eye that occurs when tears aren't able to provide adequate moisture. Risk of acquiring this condition increases with age. It's also seen more commonly among postmenopausal women. Pain has its own noble joy when it starts a strong consciousness of life from a stagnant one. Pain and pleasure, like light and darkness, succeed each other. No pain, no balm, no thorns, no throne, no gore, no glory, no cross, no crown. It's not whether you get knocked down, it's whether you get up again. Pain pays the income of each precious thing. Remember, the world is here for you. On the channel biography there's an email address. You can write, record yourself, and share the world your pain anonymously. Dry eye syndrome, also known as keratoconjunctivitis sicca, is the condition of having dry eyes. Symptoms include dryness of the eye, irritation, redness, discharge, blurred vision, and easily fatigued eyes. Symptoms range from mild and occasional to severe and continuous. Dry eye syndrome can lead to blurred vision, instability of the tear film, increased risk of damage to the ocular surface such as scarring of the cornea, and changes in the eye including the neurosensory system. Dry eye occurs when either the eye does not produce enough tears or when the tears evaporate too quickly. This can be caused by age, contact lens use, meibomian gland dysfunctions, pregnancy, Sjogren syndrome, vitamin A deficiency, omega-3 fatty acid deficiency, LASIK surgery, and certain medications such as antihistamines, some blood pressure medication, hormone replacement therapy, and antidepressants. Chronic conjunctivitis such as from tobacco smoke exposure or infection may also lead to the condition. Diagnosis is mostly based on the symptoms, though a number of other tests may be used. Dry eye syndrome occasionally makes wearing contact lenses impossible. Treatment depends on the underlying cause. Artificial tears are usually the first line of treatment. Wraparound glasses that fit close to the face may decrease tear evaporation. Looking carefully at the medications a person is taking and, if safe, altering the medications may also improve symptoms if these medications are the cause. Some topical medications may be suggested to help treat the condition. The immunosuppressant cyclosporin, may be recommended to increase tear production and, for short-term use, topical corticosteroid medications are also sometimes helpful to reduce inflammation. Another treatment that is sometimes suggested is lacrimal plugs that prevent tears from draining from the surface of the eye. Dry eye syndrome is a common eye disease. It affects 5 to 34% of people to some degree depending on the population looked at. Among older people it affects up to 70%. In China it affects about 17% of people. The phrase keratoconjunctivitis sicca means dryness of the cornea and conjunctiva in Latin. Having dry eyes for a while can lead to tiny abrasions on the surface of the eyes. In advanced cases, the epithelium undergoes pathologic changes, namely squamous metaplasia and loss of goblet cells. Some severe cases result in thickening of the corneal surface, corneal erosion, punctate keratopathy, epithelial defects, corneal ulceration, sterile and infected, corneal neovascularization, corneal scarring, corneal thinning, and even corneal perforation. Another contributing factor may be lacretin monomer deficiency. Lacretin monomer, active form of lacretin, is selectively decreased in aqueous deficient dry eye, Sjogren syndrome dry eye, contact lens related dry eye, and in blepharitis. The ocular surface microbiome, composed of a diverse community of microorganisms, has been implicated in the pathogenesis of dry eye syndrome, potentially influencing the ocular surface inflammation and homeostasis. Keratoconjunctivitis sicca usually is a chronic problem. Its prognosis shows considerable variance, depending upon the severity of the condition. Most people have mild to moderate cases, and can be treated symptomatically with lubricants. This provides an adequate relief of symptoms. When dry eye symptoms are severe, they can interfere with quality of life. People sometimes feel their vision blurs with use, or severe irritation to the point that they have trouble keeping their eyes open, or they may not be able to work or drive. Other names for dry eye include dry eye syndrome, keratoconjunctivitis sicca, dysfunctional tear syndrome, lacrimal keratoconjunctivitis, evaporative tear deficiency, aqueous tear deficiency, and LASIK-induced neurotrophic epitheliopathy. Research says new treatment options are under development. Heating systems that try to unblock the oil glands in the eye have some preliminary evidence of benefit. Keratoconjunctivitis sicca is relatively common within the United States, especially so in older patients. Specifically, the persons most likely to be affected by dry eyes are those age 40 or older. 10 to 20% of adults experience keratoconjunctivitis sicca. Approximately 1 to 4 million adults, age 65 to 84, in the US are affected. While persons with autoimmune diseases have a high likelihood of having dry eyes, most persons with dry eyes do not have an autoimmune disease. Instances of Sjogren syndrome and keratoconjunctivitis sicca associated with it are present much more commonly in women, with a ratio of 9:1. In addition, milder forms of keratoconjunctivitis sicca also are more common in women. This is partly because hormonal changes, such as those that occur in pregnancy, menstruation, and menopause, can decrease tear production. In areas of the world where malnutrition is common, vitamin A deficiency is a common cause. This is rare in the United States. Racial predilections do not exist for this disease. Prevention. Avoiding refractive surgery, LASIK and PRK, limiting contact lens use, limiting computer screen use, and avoiding environmental conditions can decrease symptoms. Complications can be prevented by use of wetting and lubricating drops and ointments. In veterinary uses, among other animals, dry eye can occur in dogs, cats, and horses. In dogs, keratoconjunctivitis sicca is common in dogs. Most cases are caused by a genetic predisposition, but chronic conjunctivitis, canine distemper, and drugs such as sulfasalazine and trimethoprim sulfonamide also cause the disease. Symptoms include eye redness, a yellow or greenish discharge, corneal ulceration, pigmented cornea, and blood vessels on the cornea. Diagnosis is made by measuring tear production with a Schirmer tear test. Less than 15 millimeters of wetting by tears produced in a minute is abnormal. Tear replacers are a mainstay of treatment, preferably containing methylcellulose or carboxymethylcellulose. Cyclosporin stimulates tear production and acts as a suppressant on the immune-mediated processes that cause the disease. Topical antibiotics and corticosteroids are sometimes used to treat secondary infections and inflammation. A surgery known as parotid duct transposition is used in some extreme cases where medical treatment has not helped. This redirects the duct from the parotid salivary gland to the eye. Saliva replaces the tears. Dogs with cherry eye should have the condition corrected to help prevent this disease. Breeds with a higher risk of dry eye compared to other breeds include 1. American Cocker Spaniel. 2. Bloodhound. 3. Boston Terrier. 4. English Bulldog. 5. Cavalier King Charles Spaniel. 6. Lhasa Apso. 7. Miniature Schnauzer. 8. Pekingese. 9. Pug. 10. Samoyed. 11. Shih Tzu. 12. West Highland White Terrier. In cats, keratoconjunctivitis sicca is uncommon in cats. Most cases seem to be caused by chronic conjunctivitis, especially secondary to feline herpes virus. Diagnosis, symptoms, and treatment are similar to those for dogs. You can't go through life allowing pain to dictate how you behave. I met someone who wants to share the world her pain. Hear from her.
Make no mistake, dry eyes are uncomfortable, often painful and irritating in all senses of the word. Hi, my name is Beth. I've struggled with dry eyes since my late 20s. It's not just an aspect of advanced years. I have high myopia and have worn contact lenses since the age of 17. If you're severely myopic like me, you get a better correction with contact lenses than with spectacles. In the late 1970s, I had a couple of bouts of conjunctivitis and my eyes were very uncomfortable. According to my mother, my grandmother had glaucoma. She died before I was born. As the disease ran in the family, I decided to speak to my grandpa about my concerns. He referred me to a specialist in Harley Street, who confirmed I didn't have glaucoma but suggested that I may be allergic to my contact lenses. I was then sent to see a contact lens specialist in London, who confirmed that I had dry eyes. At the time, he prescribed drops that had been developed as part of the NASA space program. I suppose because in the space capsules it gets quite dry. Having dry eyes has impacted my day-to-day life, particularly when I was still wearing contact lenses and working. At weekends I'd be lying on my bed in a darkened room, glad to get the lenses out and rest my eyes, rather than going out and doing things. My eyes were so dry and itchy, so I tried to use whatever lubricant I could. Working in an office could be challenging at times, because they're very often air-conditioned and dry, which made my eyes worse. It can be a pain, as however uncomfortable your eyes feel, you mustn't touch them. I remember my ophthalmologist telling me not to rub my eyes, and that if ever I felt my hands drifting towards them, I should think first about what that hand had touched and where it had been. I think this advice still stands today, particularly with the onset of COVID-19 and the possibility of it being transferred through your eyes. I had cataract surgery in my mid-50s, and so no longer wear contact lenses anymore, which has helped. But make no mistake, dry eyes are uncomfortable, often painful and irritating in all senses of the word. I recently began to experience twitching in my lower left eyelid, which scared me as my father, who died when I was 11, had early onset Parkinson's. But my optometrist told me that twitching is a normal feature if you have dry eyes and is called myoclonus, which I'd never heard of. Knowing what drops are best can be difficult sometimes, as I found some to be intolerable, but the Glaucoma UK helpline have been very supportive with that. If you've got sight problems or something wrong with your eyes, I would recommend you join organizations like Glaucoma UK. Eye clinics don't always tell you much, nor have the time to really answer your concerns, so it's important you explore other avenues. The Glaucoma UK helpline also helped to reassure me that pressure-lowering treatments such as drops or surgery don't exacerbate dry eye disease. I often used to wonder if it might be the case, since their purpose seems to be to reduce the amount of fluid in the eye. They explain that glaucoma eye drops, and particularly the preservatives inside the drops, can sometimes affect the quality of the surface of the eye, which can make it feel dry. As with so many things medical, it does feel sometimes like you're between a rock and a hard place. Thanks for listening. Goodbye.
Signs and symptoms. Typical symptoms of dry eye syndrome are dryness, burning, and a sandy, gritty eye irritation that gets worse as the day goes on. Symptoms may also be described as itchy, stinging, or tired eyes. Other symptoms are pain, redness, a pulling sensation, and pressure behind the eye. There may be a feeling that something, such as a speck of dirt, is in the eye. The resultant damage to the eye's surface increases discomfort and sensitivity to bright light. Both eyes usually are affected. There may also be a stringy discharge from the eyes. Although it may seem contradictory, dry eye can cause the eyes to water due to irritation. One may experience excessive tearing, such as if something got into the eye. These reflex tears will not necessarily make the eyes feel better, since they are the watery tears that are produced in response to injury, irritation, or emotion which lack the lubricating qualities necessary to prevent dry eye. Because blinking coats the eye with tears, symptoms are worsened by activities in which the rate of blinking is reduced due to prolonged use of the eyes. These activities include prolonged reading, computer usage, computer vision syndrome, driving, or watching television. Symptoms increase in windy, dusty, or smoky, including cigarette smoke, areas, in dry environments, high altitudes including airplanes, on days with low humidity, and in areas where an air conditioner, especially in a car, fan, heater, or even a hair dryer is being used. Symptoms reduce during cool, rainy, or foggy weather and in humid places, such as in the shower. Most people who have dry eyes experience mild irritation with no long-term effects. However, if the condition is left untreated or becomes severe, it can produce complications that can cause eye damage, instability of the tear film, neurosensory changes, impaired vision, or, rarely, in the loss of vision. Treatment. A variety of approaches can be taken to treat dry eye syndrome. Approaches include avoidance of exacerbating factors, things that make it worse, tear stimulation and supplementation, increasing tear retention, eyelid cleansing, and treatment of eye inflammation. Conditions such as blepharitis can often coexist, and paying particular attention to cleaning the eyelids morning and night with mild soaps and warm compresses can improve both conditions. There is evidence that long-chain omega-3 supplementation may be helpful. However, probiotics, fish flax and hemp oil, omega-3 supplements do not appear to be effective in relieving symptoms. Surgery. In severe cases of dry eyes, tarsorrhaphy may be performed where the eyelids are partially sewn together. This reduces the palpebral fissure, eyelid separation, ideally leading to a reduction in tear evaporation. Causes. Any abnormality of any one of the 3 layers of tears produces an unstable tear film, resulting in symptoms of dry eyes. Increased evaporation. The most common cause of dry eye is increased evaporation of the tear film, typically as a result of meibomian gland dysfunction, MGD. The meibomian glands are two sets of oil glands that line the upper and lower eyelids and secrete the oily outer layer of the tear film, the lipid layer. These glands often become clogged due to inflammation caused by blepharitis and or rosacea, preventing an even distribution of oil. The result is an unstable lipid layer that leads to increased evaporation of the tear film. In severe cases of MGD, the meibomian glands can atrophy and cease producing oil entirely. Low humidity may cause dry eye syndrome. Decreased tear production. Keratoconjunctivitis sicca can be caused by inadequate tear production from lacrimal hypersecretion. The aqueous tear layer is affected, resulting in aqueous tear deficiency, ATD. The lacrimal gland does not produce sufficient tears to keep the entire conjunctiva and cornea covered by a complete layer. This usually occurs in people who are otherwise healthy. Increased age is associated with decreased tearing. This is the most common type found in postmenopausal women. In many cases, aqueous deficient dry eye may have no apparent cause, idiopathic. Other causes include congenital alacrima, xerophthalmia, lacrimal gland ablation, and sensory denervation. In rare cases, it may be a symptom of collagen vascular diseases, including relapsing polychondritis, rheumatoid arthritis, granulomatosis with polyangiitis, and systemic lupus erythematosus. Sjogren syndrome and other autoimmune diseases are associated with aqueous tear deficiency. Drugs such as isotretinoin, sedatives, diuretics, tricyclic antidepressants, antihypertensives, oral contraceptives, antihistamines, nasal decongestants, beta blockers, phenothiazines, atropine, and pain-relieving opiates such as morphine can cause or worsen this condition. Infiltration of the lacrimal glands by sarcoidosis or tumors, or post-radiation fibrosis of the lacrimal glands can also cause this condition. Recent attention has been paid to the composition of tears in normal or dry eye individuals. Only a small fraction of the estimated 1,543 proteins in tears are differentially deficient or upregulated in dry eye, one of which is lacretin. Topical lacretin promotes tearing in rabbit preclinical studies. Also, topical treatment of eyes of dry eye mice, a knockout mouse model of dry eye, restored tearing, and suppressed both corneal staining and the size of inflammatory foci in lacrimal glands. Additional causes: excess screen time on computers, smartphones, tablets, or other digital devices can cause dry eye. Humans normally blink about 15 times in 1 minute. However, studies show that we only blink about 5 to 7 times in a minute while using computers and other digital screen devices. Blinking is the eye's way of getting the moisture it needs on its surface. Aging is one of the most common causes of dry eyes because tear production decreases with age. Several classes of medications, both prescription and OTC, have been hypothesized as a major cause of dry eye, especially in the elderly. Particularly, anticholinergic medications that also cause dry mouth are believed to promote dry eye. Dry eye may also be caused by thermal or chemical burns, or, in epidemic cases, by adenoviruses. A number of studies have found that people with diabetes have an increased risk for the condition. About half of all people who wear contact lenses complain of dry eyes. There are two potential connections between contact usage and dry eye. Traditionally, it was believed that soft contact lenses, which float on the tear film that covers the cornea, absorb the tears in the eyes. The connection between a loss in nerve sensitivity and tear production is also the subject of current research. Dry eye also occurs or becomes worse after LASIK and other refractive surgeries, in which the corneal nerves which stimulate tear secretion are cut during the creation of a corneal flap. Dry eye caused by these procedures usually resolves after several months, but it can be permanent. Persons who are thinking about refractive surgery should consider this. An eye injury or other problem with the eyes or eyelids, such as bulging eyes or a drooping eyelid, can cause keratoconjunctivitis sicca. Disorders of the eyelid can impair the complex blinking motion required to spread tears. Abnormalities of the mucin tear layer caused by vitamin A deficiency, trachoma, diphtheric keratoconjunctivitis, mucocutaneous disorders, and certain topical medications are also causes of keratoconjunctivitis sicca. Persons with keratoconjunctivitis sicca have elevated levels of tear nerve growth factor, NGF. It is possible that this eye surface NGF plays an important role in ocular surface inflammation associated with dry eyes. The longer you have pain, the better your spinal cord gets at producing danger messages to the brain, even if there is no danger in the tissue. In life, pain is inevitable. Whether physical or mental, we all deal with pain daily. Pain and suffering are part of human life. Look at the pain in your life with a new lens. If there were no pain in the world, we would probably be reckless, and nothing would be of value to us. However, thanks to pain, we learn to appreciate life itself and everything around us. Remember, the world is here for you. On the channel biography there's an email address. You can write, record yourself, and share the world your pain anonymously. Thanks for watching. Don't forget to like, subscribe, and share. Catch you later.